right, are you ready to put your money where your mouth is? If you find searching for the right lip treatment to be completely exhausting, you're not alone and you need to listen to this. I will be pulling the curtain back on surgical lip lifting and even giving you some secret tips to make your recovery a complete breeze. All right, first off, congrats on taking that final step to achieving your perfect pout. But before we celebrate, let's take a moment to calm those nerves. Having a really clear understanding of the procedure and what to expect during recovery will definitely help ease your mind and make the recovery process easy peasy. So let's break it down. A subnasal lip lift and a lip advancement are two different surgical procedures that aim to enhance the appearance of the lips. I'm going to grab my trusty pen here to help highlight some things. The subnasal lip lift focuses on improving the visibility of the pink portion, which is here, of the upper lip by removing a small amount of skin directly beneath the nose. The incision is along this area. While on the other hand, a lip advancement involves the removal of a small amount of skin either above the pink portion of the upper lip, so here, directly by the lip, or the pink portion below the lower lip, so along this area. Now, both procedures follow a similar three-step process to achieve the desired outcome. First, a small incision is made. Next, excess skin is removed. And finally, a thin single line of sutures is used to close the incision. Now, did you know that all lip contouring procedures can be performed in an outpatient setting? And if you use local anesthesia, the procedure can be done without any need for general anesthesia. But don't worry if you're completely freaked out by needles or if you just want to be sedated and not have any idea of what's going on, lip contouring treatments can also be performed in an operating room under sedation. However, I will say, and most of my patients will agree with me on this, it's worth noting that the vast majority of patients who undergo lip contouring procedures as a standalone procedure, meaning without any other treatments attached, have the treatment done in the office with the use of local anesthesia without any issues whatsoever. Now, once the procedure is completed, the main goal for the rest of the day is to rest, apply ice, and to just stay comfortable. The numbing effect of the local anesthesia usually lasts for a couple of hours after the procedure, but you probably are going to need to take your prescribed and recommended medications to manage any discomfort, especially that first and second day. You're going to experience some swelling and bruising after the procedure, which generally increases over the next 48 to 72 hours. But by day 3 to 5, you should start to notice some gradual subsiding of the swelling and bruising, with most patients feeling much better, kind of what I call turning the corner, by day 5. Also, your sutures are typically going to be removed within that first week following your procedure. And finally, as promised, let's go through some of those helpful key tips to make your recovery a breeze. So let's get started. You should definitely follow your physician's instructions on taking prescribed medications and follow any recommended home care cleaning regimen. It's important for proper healing. As I said before, expect to have your swelling increase over 48 to 72 hours post-procedure. And just to let you know, the lower lip generally swells more than the upper lip. Asymmetry and unevenness are normal. Do not stress about that during your first couple of weeks. You need to stay hydrated and definitely eat as tolerated. You don't have any restrictions on diet, but generally a softer diet is going to be more tolerable for you and for the sutures that are trying to heal. Remember to apply cool compresses at 15-minute intervals and don't fall asleep with them on your face. Keep your head elevated. Walking around definitely improves swelling and bruising. Homeopathic medications I recommend are arnica montana and bromelain. They really help decreasing bruising, swelling, and pain. Definitely avoid any strenuous activity or lifting more than about 15 pounds your first week or two after surgery. And if you have any concerns, you always should follow up with your provider's office during business hours. It's more likely someone's going to be available at 2 p.m. rather than at 2 a.m. All right, if you found this helpful, I encourage you to subscribe to my channel so you don't miss my next video. You can find all of my office's contact information and social media platforms below. Thanks for watching and give my office a call when you're ready to schedule your procedure. Talk to you soon.